This is your guide to intermittent leave, a kind of medical leave that doesn't happen all at once, but in bursts. You can kind of think of it as the flare up clause in the Family and Medical Leave Act. This is for people who can't always predict when symptoms will hit, or who need time off for regular treatment, such as therapy, medication adjustments, or brain fog days. The system is bad at understanding nuance, but this is the part where you get to say, I can't do this every day, and that's valid. So intermittent leave is leave that you take in non-consecutive blocks of time. It could be an hour, a day, or a few days at a time. Could be pre-scheduled. For example, weekly therapy every Thursday. Or unplanned, when you have flare-ups of anxiety, insomnia, or panic attacks. You don't need to disappear for 12 weeks straight to qualify for protection. So how does this appear on the FMLA form? This will show up in question 9 if you're looking at the WH380E form. It asks, is it medically necessary for the employee to be absent on an intermittent basis? Your provider needs to check yes for that box, estimate how often flare-ups or treatments will happen, estimate how long each one might last. Some examples: up to 2 times per week, lasting approximately 4 to 6 hours per episode, or 1 to 2 days per month for symptom management or therapy. Common mistakes to avoid include vague answers like as needed, because they're too open-ended, saying symptoms are unpredictable without giving a range. You can say it varies, but they still need to guess, even if loosely. Saying no to intermittent leave when your therapy is weekly. So here are examples of what intermittent leave might cover. When your brain or body shows up to work like a chaotic guest star, intermittent leave is probably going to be your friend. Weekly therapy or psychiatry appointments, recovery days after panic attacks or insomnia, migraines, disassociation, trauma flare-ups, avoidance of triggering tasks like public speaking or customer escalations, medication adjustments causing side effects, and regular mental check-ins that can't happen outside of work hours. You don't need to be in a consistent crisis to qualify. You just need to show your symptoms interfere with your ability to work at least occasionally. So how do employers track intermittent leave? Here's where it gets messy. Some employers use a call-out system where you call HR or the leave admin each time you use FMLA time. A points system where they track absences like violations, except FMLA time can't legally count against you. A designated FMLA calendar or HR tracking spreadsheet. If you're approved for intermittent leave, your employer must track it without penalizing you. But some systems, especially retail, hospital, and school systems, are not exactly compassionate. So keep a record of every call out. Here's a reminder of some of your rights. You don't need to predict your episodes perfectly. You don't need to ask permission every time if you're already approved for intermittent leave. You can still request full day or partial day leave. You can use intermittent leave to reduce hours temporarily. So here's a pro tip. If your symptoms are unpredictable, ask your doctor to estimate a range that allows for flexibility without overpromising. And how to talk to your doctor about intermittent leave. Here's some things you can say to your doctor when you call or when you're in the appointment to explain what you need. I'm doing okay some days, but I also have days where I just can't function. Would you be able to document that I may need 1 to 2 days per month for treatment or symptom flare-ups? I don't need full leave, but I need flexibility. Here are some more tips on how to use it. Number 1, get approved with the right language on the form. Number 2, learn your employer's call-out process. Number 3, keep a log of each time you use it. Number 4, if HR pushes back, remind them, this time is protected under FMLA. Here's my doctor's documentation. Final reminder, it's still work to rest. Using intermittent leave isn't failure. It's you creating breathing room in a system that treats exhaustion like a personal problem. Use it unapologetically. Do it, lady.